Thanks for staying with us. Welcome back to our news bulletin tonight. Now, if you watched the Citizen, Semana Citizen, and also on Daybreak, we were reporting of yet another outbreak of cholera that has been reported in Nakuru County. So tonight, our explainer is all about the cholera outbreak and what you need to know. So I'd like us to begin, first of all, with this. You need to know that cholera is on a list of diseases that are known as notifiable diseases. These are the ones that are considered a threat to public health. Others on this list are Ebola, the Marburg virus, dengue fever, anthrax, and even polio. They are treated very differently from other diseases. When an outbreak is reported, a certain protocol kicks in to quickly contain the disease. But for starters, let's understand this. It only takes one reported case for this to be declared an outbreak. This is why we should all be concerned with this number, because this year alone, 1,400 cases have been reported from January to date, with 8 dead. The affected counties include Nairobi, Garissa, Machakos, and Kajiado, with estates like Nyayo and Donholm here in the capital being identified as hotspots by the Nairobi County Health Department. Now, before we move, it is important for us to correct this misconception that many have about cholera. It is not a poor man's disease, as witnessed by the latest outbreaks that have been reported at Nairobi Hospital, with 65 cases so far. Let me take you down memory lane for a moment. In July 2017, 3 top government officials, that's the Treasury CS Rotich, Trade CS, then Adan Mohammed, and the Trade PS, were all treated and discharged for cholera symptoms after eating food at a trade fair at the KICC. The same year, 26 participants were admitted with cholera while attending a conference at Western Hotel. 3 people died from cholera still in the same year after attending a wedding in Karen. So it can affect anyone, which is why you need to pay attention. So let's take a look at what happens when an outbreak is reported by the Ministry of Health, or indeed by the county government. Now, the Ministry of Health is required to do some 2 very important things. The first is to respond to those affected. It's required to give them treatment, to quarantine them, and also to investigate and find the original source of the disease. Now, because it is a waterborne disease, they must find the contaminated source. Now, there's an infectious disease and isolation center or unit at the Kenyatta National Hospital where all patients must be quarantined while receiving treatment, and that helps to prevent further spread of the disease. The second thing that they must do is start public health campaigns. Now, the public health campaign includes 3 components. The first is how to prevent the disease, the spread of it, what to do when you know someone who has symptoms of it, and what to do when you yourself are affected. Well, so whilst they're doing that, let's try and take a look at the symptoms. How do you know if you are affected? These are the symptoms you need to look out for. The first, a sudden onset of diarrhea, which can be quite acute, and that can quickly dehydrate your body if it is not quickly treated. In fact, many patients experience a dry mouth as a result of the dehydration. Other symptoms include vomiting and nausea. Now, it is that rapid loss of body fluids through diarrhea that can lead to kidney damage and even death. Now, get this, in extreme cases, death can occur within 4 hours of the onset of the symptoms. So, if you notice any of these symptoms, please go to your nearest hospital. Especially now during this outbreak, do not go to the pharmacy and self-medicate. Get yourself properly diagnosed by a doctor and then get the treatment that you deserve. And what is that treatment? It's mainly rehydration. The doctors and healthcare officials will be seeking to give you fluids to replace those you have lost during diarrhea. Now, there's also an antibiotic treatment, and that's fairly affordable and easily accessible. But please get yourself checked and the diagnosis done. It's a rapid test, so it is something that can happen very easily. Now, this is something else that would be in the government communication measures. Prevention. Number 1. to note, cholera is contracted from a contaminated water source. So prevention includes water and sanitation health measures, also known as WASH, right? So make sure you're using clean drinking water. Look out, by the way, for fruits and salads. These can also carry the bacteria that causes the disease, Vibrio cholerae. Keep all foods covered and practice proper hygiene. You know the things we tell our children to do: wash your hands before and after eating, and most especially after visiting the toilet. Vaccines are also available. Now, there is no government intervention yet with the vaccination, but it can be accessed from private sector distributors for about 1,550. Let me end by saying this, that this particular cholera outbreak has not yet been contained. Until there is isolation and quarantine of patients and zeroing in of the original source of contamination. That is why we continue to see these cyclical outbreaks for the last few years, actually since 2014. So it is important right now to look after yourselves and practice good hygiene. So that is what you need to know tonight. Let's take a quick break. Back with the day's business news.